everyone. I'm Dr. Singh. I am a UCNS certified headache neurologist, and I'll be talking about SUNA and paroxysmal hemicrania today. And these are two headache disorders. And don't worry if you don't know what that means at all. We're going to go over that today. So today we'll be talking first about the etiology of these disorders, the epidemiology, the clinical presentation, and the treatment. So these two headache disorders fall under a group of headache disorders called the trigeminal autonomic cephalalgias. Trigeminal is the trigeminal nerve is a nerve that's sends sensory signals to our face. Autonomic are these automatic things that happen in our body, and cephalalgia means headache. So you'll come to find out this is why these headaches are named this way. But they're a group of primary headache disorders. Primary headaches are the headaches that kind of come on out of nowhere in a way, like migraine. They're not due to a secondary thing like a tumor or a stroke or head trauma or something like that. They kind of just come about. These headaches are characterized by unilateral head or face pain, and they have autonomic symptoms on the same side. Autonomic symptoms constitute redness of the eye, tearing of the eye, nasal congestion, nasal drainage, a droopy eyelid, eyelid swelling, or facial sweating. And this happens on the same side of the pain, like I said. And the different headache disorders under this umbrella of trigeminal autonomic cephalalgias are differentiated based on how long the pain lasts. So talking about SUNA, this is short for short-lasting unilateral neuralgiform headache attacks. And under this umbrella of SUNA are SUNCT and SUNA, which you may or may not have heard of. Maybe you have this diagnosis. And these are separated because SUNCT includes conjunctival tearing and injection, both of these symptoms. That means running of the eye and also redness of the eye. So you have to have both of those symptoms to have SUNCT. And if you only have one of those, or you have some other autonomic symptoms associated with your pain, then you have SUNA. The actual criteria for this headache disorder is that you have to have at least 20 attacks of moderate or severe unilateral pain, usually around the eye, behind the eye, at the temple, or in this trigeminal distribution, which is basically your face, and that has to last from anywhere from 1 to 600 seconds. So these are short headaches. They can occur as single stabs, a series, or in a sawtooth pattern. And you have to have some autonomic symptoms that we've talked about associated with this pain on the same side. This has to happen at least once a day, and it's not accounted by another headache disorder diagnosis. This is differentiated into an episodic form and a chronic form. The episodic form is when you have periods of no pain lasting 3 months or longer. The other headache disorder that we're talking about is called paroxysmal hemicrania. And this is defined by having at least 20 attacks again, having pain kind of in that same eye area, temple area on one side, lasting anywhere from 2 to 30 minutes. So this is longer than SUNCT and SUNA. And you have to have autonomic symptoms on the same side. Or you can actually just have a sense of restlessness or agitation. So associated with the headache, maybe you're pacing around, you just can't get comfortable. That's what they mean by restlessness or agitation. You're not laying down under the covers, like, for example, contrasting this with migraine. You have to have at least 5 attacks per day or more. And the interesting thing about this headache disorder is that it's treated by a specific medication called indomethacin. And so if you take this medicine and your headache goes away completely, that's part of the criteria, and that is indicative of you having this specific headache disorder called paroxysmal hemicrania. Part of the criteria is also that you don't meet criteria for a different headache disorder. This also comes in an episodic and chronic form. The episodic form is the one where you have at least 3 months of no pain. So why do people get these headache disorders? Like I said, this is a primary headache disorder, so it's not really fully understood why these headaches occur, or they kind of just come about, you could say. There is involvement of the trigeminal vascular system. There's some release of these inflammatory neuropeptides. Maybe you've heard these words of PACAP and CGRP. The trigeminal autonomic reflex gets involved, and that's how you get those autonomic symptoms. And the hypothalamus, a specific part of the brain, is also involved. And that's why sometimes some of these headache disorders have a rhythmicity to them. There are some genetic factors that are associated with these headaches, some environmental factors. But the important thing here is to make sure that this isn't a secondary headache disorder. So it's not because you have a mass or a aneurysm or something else pushing on a nerve causing these symptoms. So generally, when you present to your doctor with symptoms of these headache disorders, they should be getting some imaging to rule out a secondary cause. This is just a picture of the trigeminal autonomic cephalalgias. So it has on top this hemicrania continua, which we're not really talking about today, cluster headache. So hemicrania continua is a constant headache. Cluster headache is a longer headache than the ones that we talked about. We're talking about paroxysmal hemicrania, the third one down here on the left. And that, like we said, is usually lasting 2 to 30 minutes. And can happen, it should be happening more than 5 times a day, but can happen up to 40 times per day. SUNCT and SUNA is the shortest of these headache disorders and lasts anywhere from 5 to 600 seconds and can occur from anywhere from 3 to 200 times per day. And the schematic of this brain is showing different parts of the brain that are involved. We mentioned the hypothalamus, which is here in purple. And this particular picture is showing different treatment options which target different areas of the brain here. Is this common? Are these headache disorders common? And the answer is actually no, they're pretty uncommon. There's a Norwegian study that showed the 1-year prevalence for SUNHA is about 1.2 per 100,000 adults. So that's a very low percentage. Paroxysmal hemicrania is a little bit more common based on the same study, 2.2 people per 100,000 adults. Paroxysmal hemicrania is more common in women. And just to contrast this with migraine, one of the most common headache disorders, not the most common, but one of the most common, the 1-year prevalence of migraine is about 15%, which is 15,000 people per 100,000 adults. So you can see with these numbers how this is not very common at all. So the treatment of these disorders is different than some of the other more common headache disorders. The treatment of SUNCT and SUNA, there are some oral medications like lamotrigine, topiramate, gabapentin can be used, carbamazepine can be used. There's some procedures also like IV lidocaine infusions, occipital nerve blocks, SPG blocks. And if none of these treatments are helpful, surgery can even be recommended. So if on imaging, it's noted that there's compression of the trigeminal nerve that can be decompressed with surgery, with brain surgery. You can do deep brain stimulation. Other treatments like gamma knife surgery are also options for really refractory cases. The treatment of paroxysmal hemicrania, there's also medications that can be used. Like we mentioned earlier, indomethacin is the first treatment option for this, and it's a diagnostic of paroxysmal hemicrania. Other COX-2 inhibitors, which are a type of non-steroidal anti-inflammatory medication, can also be used in people who can't tolerate indomethacin. Topiramate is another option. Again, we can do occipital nerve blocks, SPG blocks for treatment of paroxysmal hemicrania. These are procedures. And then there's a device that's a non-invasive vagal nerve stimulator, which can be useful for the treatment of paroxysmal hemicrania in someone, let's say, who can't take oral medications or can't also get the procedures, or those things weren't helpful for them. And that's really all I had for these two disorders today. I hope you learned something about SUNCT, SUNA, and paroxysmal hemicrania. Please feel free to reach out if you have any questions.